our mission our mission at the Asthma Foundation is to empower families globally, delivering life-saving sickle cell education. And SCalate is definitely all about that. It looks like Scalate, but it's because it's spelled SCalate, and that is an acronym for sickle cell across the lived and treatment experience. Uh, we have an origin story of our founder who was born an identical twin with and lost his brother later in life during a football workout due to sickle cell trait exertion. So, along the spectrum of sickle cell disease and trait, we have an appreciation for that, and we seek to. We're interested. We have questions, and we seek out answers. But we also believe in the family, the sickle cell family, which, if you are born with sickle cell disease, then there's a high likelihood that your parents had trait. And certainly if you live with sickle cell disease and choose to procreate, your children will at least live with sickle cell trait. So across the lived and treatment experience is our uh, pronunciation of our respect of that spectrum. So with that said, thank you all for being here. This is an informal environment, although we have some really heavy hitters tonight that are going to educate us on something really, really important. Did you know that Texas has a sickle cell registry? Well, yes, it does. But there are lots of questions and concerns, certainly, that I've come across in my inbox or in conversation. So, as we say, those of you that are not on screen, you're certainly welcome to type your questions and comments in the chat, uh, as well as you can come off mute and ask your question at any time. Our guest speakers are warned that we are here to deliver information, but we're absolutely here to answer questions. And if we can't answer them, we will work to find answers. We meet here at SCalate every third Thursday of the month, and we're so delighted that we will be digging into this topic for the next few weeks. So please stay tuned. But at this time, I am going to turn my mic off and welcome our speakers to introduce themselves. And Prashant, will you need to share your screen?
No, Victoria's going to do it.
Okay,
Victoria's fine.
so you guys take it away. Welcome.
Go ahead, Victoria.
Thank you so much, Dr. Austin, for the invitation. We're absolutely thrilled to be here. It's nice to meet everyone. My name is Victoria Salinas, and I'm a medical research specialist in the Environmental Epidemiology and Disease Registry section at the Texas Department of State Health Services. So I serve as a lead for special projects within the section, including the Texas Sickle Cell Data Collection Program. And I'll pass it off to my colleague, Prashant.
Thank you, Victoria, and thank you, Dr. Austin, for having us. I am a business analyst at the Environmental Epidemiology and Disease Registry section at Texas Department of State Health Services. And I serve as the lead for a lot of the researching and developing the IT/business requirements to inform the implementation of what the sickle cell registry is going to look like. Thank you.
Well, so I guess I'll just start it off by letting you know that there's interest, but if your presentation is going to start out saying what it is and what we can expect, then go for it. But I think that that's like the basic question. What is the sickle cell registry, and what is it going to do? And another question, of course, has to do with private. It's our identity is going to be protected, and what is this whole opt-in thing all about? So too many questions to start, but if your presentation is going to answer that, then go right ahead.
Absolutely. So I will share my screen. Let's see. Alrighty. Can we see the title slide? Fantastic. Alrighty. So, hi, good evening. We are very happy to share this space with you today, and we are excited to offer an initial brief introduction to the upcoming Texas Sickle Cell Disease Registry. So we'll start by sharing about the Sickle Cell Data Collection Grant, which is the State Health Department's current effort at examining sickle cell disease data in Texas. And we'll then move on to the Texas Sickle Cell Disease Registry and the work necessary to inform its implementation. And we'll have some time at the end for questions from the group. So the Sickle Cell Data Collection Grant, also known as SCDC, is administered by the Centers for Disease Control Prevention, also known as the CDC. So the evolution of SCDC began in 2010 as the Registry and Surveillance System for Hemoglobinopathies, also known as RUSH. 2 years later, RUSH was then reorganized as the Public Health Research and Surveillance for Hemoglobinopathies, or FRESH. 2 years later again, FRESH was reorganized into what we now know as the SCDC, which has been hard at work since 2015 with a specific focus on sickle cell disease. So sickle cell disease is estimated to affect more than 100,000 people in the US, but the exact number of people with sickle cell disease is unknown. So the CDC's Sickle Cell Data Collection Grant gathers health information from multiple sources to determine how many people live with sickle cell disease in a particular state and to understand their health and healthcare needs. Data obtained through the Sickle Cell Data Collection Grant are used to support policy decisions and resource allocation at the state and federal level to help improve and extend the lives of those living with sickle cell disease. So with this primary goal in mind, the Sickle Cell Data Collection Grant focuses on these areas: data collection and use, community engagement, communications, and policy. We have some examples of past products developed using data obtained through the grant. So to the top left are toolkits on various health topics related to sickle cell disease. To the bottom left are peer-reviewed publications. The top right, we have infographic on Medicaid coverage for people with sickle cell disease in California and Georgia. And then to the bottom right is the stories of sickle cell, which showcases the faces and experiences of the sickle cell community. So the Sickle Cell Data Collection Grant currently works with teams in 16 states to collect and link data from several sources. These 16 states represent about 50% of the US sickle cell disease population. And of these 16 states, only 2 are authorized by their state government to implement a state sickle cell registry. And those SCDC states are Florida and Texas. So the Sickle Cell Data Collection Grant in Texas is the result of efforts by community and public health leaders to improve the understanding of sickle cell disease within our state. Although not a registry, the Sickle Cell Data Collection Grant in Texas aims to use multiple linked data sources at the state level to better estimate the number of individuals with sickle cell in Texas, to understand their healthcare use and outcomes, and to inform sickle cell practices and policies in Texas. So this is an effort that has really helped lay the foundation for the new sickle cell disease registry in Texas. The Sickle Cell Data Collection Grant in Texas first began with a notice of award from the CDC in September 2023. And as part of that grant, we convened a diverse group of stakeholders within a multidisciplinary team to help guide the grant work. And so this multidisciplinary team includes folks with expertise in surveillance systems, healthcare claims, pediatric and adult healthcare specific to sickle cell disease, mental health care, community health, health communications, government relations and policy. And then, of course, we also have our community-based organizations, individuals living with sickle cell disease, and caretakers represented in this group. So we first met with this group in January of 2024, and we continue to meet with them regularly to help inform the work related to the grant. As our grant work is not legislatively mandated, the way the registry is, we have to submit an application to the Institutional Review Board to receive approval for data collection. And so we submitted that application in March 2024 and received approval to access data in August 2025. We received our first data set earlier this year, and we have begun initial analyses related to the grant activities. So it's really fantastic that we're able to start the journey to a sickle cell disease registry in Texas with the sickle cell data collection grant. We're able to apply what we've learned implementing the grant to help inform and shape the new Texas sickle cell disease registry. So I'll now pass it along to Prashant, who will share more about the new sickle cell disease registry and steps we're taking to inform its implementation.
Perfect. Thank you, Victoria. That was great. So now we'll talk a little bit more about the registry. So a little bit of background. The Texas Sickle Cell Disease Registry was promulgated by the Texas legislature in 2025. And as part of that, we were asked to maintain the Sickle Cell Registry due to the legislative Chapter 52B. The other part to this chapter is that the registry will require consent from any individual that is included in the registry, the opt-in portion. And we'll get further into that as we keep going along. Next slide, please. I'm going to talk about some similarities and differences between the grant versus the registry. So if we look at the grant, the differences are it's a one-time snapshot of the data for sickle cell disease, which was authorized by the Institutional Review Board. Obviously, it'll require less resources, and the data is for previous years. Now, looking at the registry, it is a continuous longitudinal and long-term data collection that we're going to be doing for our patients that opt in to the registry. This was authorized by the Texas legislature. It's going to require a lot more resources. And again, as I mentioned, patient opt-in for the continuous data collection. Now, something that we're going to do that's going to help both of them is we're going to have a secure database to protect their information. Any data we publish will not be identifiable. It'll be sort of de-identified data, so no, we can't get any social names, any of that out. And this will help inform all the practices and policies that come along with it. Perfect. So as part of the registry assessment, there were some objectives that we decided to look at. So the first thing that we did was a review of the states that have a sickle cell disease registry to understand how they work today. What type of registry, opt-in, opt-out, how they capture the patient data, including some of the best practices and or feedback that they had as they built their registry. The second objective was to engage different stakeholders, such as yourself, and to learn about what kind of data the registry should have, how we can engage our direct patients and consumers of the registry, and how the registry will benefit the overall sickle cell disease population in Texas. Okay. And as part of the goal, the outcomes for some of the is going to be building a roadmap to establish a community-based sickle cell disease registry with feedback from many different perspectives, which will give us a better registry for a lot of the patients that we can include in there. And then our goal is to understand viable technical solutions and the cost to building this registry so we can get it onboarded. Okay, and then current sickle cell registries that we looked at were Florida, Louisiana, Nevada, South Carolina, and Virginia. And then the next slide is just this slide is just a comparing of when it was implemented, in which state, the type of sickle cell tracking, the consent model. This is actually a really big thing that we're looking at to see if we could use the model from maybe South Carolina or Virginia, but it seems like, we'll have to figure that out. And then how the data sources were connected, how and what data sources they were using. So we have that administrative, patient self-report, etc. Awesome. So now these are the activities that we have to do as part of the requirements for the registry. In terms of discovery, we've already completed it, and this was again working with the different states that have sickle cell disease registries, just to learn more, get their best practices for building the best Texas registry, and that is complete. And then in terms of requirements, this is currently in progress because the requirements define the scope and the boundaries of what the registry should do, from capturing consent to storing the patient data and running reports on that data. And then the architecture design is sort of the technical of how we're connecting the systems, where we expect the data to be housed, having a firewall, different things like that. And then we'll take all of that and go to different vendors such as Deloitte and say, hey, these are the requirements we want you to build to. How much are you going to charge, and can you do it? right? And then we'll compare. The next part will be basically comparing the different vendors and the solutions to see who can do the most, the costs, and do look at trade-offs as we go further. And then we'll take all of that and finalize it into a official summary and findings report that we'll present to the legislature. And that is all I have. And then the last part is please let us know if you have any future topics you would like us to present. And then, this will help us understand the different stakeholders' point of view so we can build the best registry. And that's all I have. Thank you.
Thank you both. I have probably 10 questions, but I would certainly like to encourage our participants tonight, as well as those that will listen and view this on our YouTube, to put your question in the chat if you're listening later, or if you're comfortable doing that now, or coming off mute to ask your question. This is a great thing. We should feel good about a Texas sickle cell registry. That's number one. So, gosh, you said a lot of things, and I wanted to interrupt, but consent. You said something about a consent model. So I want to understand, or have you elaborate about the consent model versus what we have. And then on the slide where there was like 5 states, all of them were opt out.
Mm-hmm.
So I know in one setting, I thought I heard that Texas was the only, no. I think we heard that this registry in the entire Texas data collection is the only one that has an opt-in or out clause. Please correct that and explain that as well. And then my last question has to do with, is there an opportunity for the Texas registry to include trade, as I see Florida does? And I'll stop right there. Anybody else, please come off mute, ask your question, or put it in the chat.
Yeah, so I can start off with I believe your second question was about how many other opt-in registries are in Texas. There's only one other opt-in registry in the state of Texas, and that is the Adult Immunizations Registry. So with that registry, it's just reporting your adult vaccinations to the state health department, and that's held in a registry database. And so aside from that, we are the only other opt-in registry in the state of Texas. And as you can see nationally, opt-in models are not very common. And so with these sickle cell registries that are in current existence across the nation, the only other opt-in one is South Carolina. Mhm. And so we are working on drafting a consent process for patients to opt in to the sickle cell disease registry for the state of Texas. And so that process at a high level will look like the state health department will identify individuals who have sickle cell disease, most, of course, through newborn screening, and then possibly also through electronic case reports that are submitted by facilities. And so once we have identified those individuals with sickle cell disease, we will then reach out with our initial contact, share information about the registry, and then information on how to opt in to the registry. And so we have a general outline of how that consent process will look like, but that's still in a draft. But that's the process that we would like to present to this group and to other community groups so that we can really get feedback on what makes sense for individuals in Texas who would like to opt in to the registry. And so right now, your other question was regarding trait. So currently, the legislature has only mandated or provide legislative authority for us to collect information on sickle cell disease. So we don't quite have the legislative authority to also collect information beyond that. So at the moment, the scope is not minimized, but limited. That's the word.
Mm-hmm.
The scope is limited to sickle cell disease, but that may change in the future, depending what the legislature decides. And I do see we have someone with their hand
Daryl?
raised.
Go ahead, Daryl. Come off mute.
Yes, I was just gonna ask what, if anything, that we can do ask CBOs to collect this information or get people registered?
Yeah, so definitely helping us with informing what that opt-in process will look like, because we want it to make sense to the folks that will be opting in, and really looking to the registry to provide information that can help inform these practices and policies for the state of Texas. So being engaged throughout that feedback process is something that would be very helpful for us. And then also we will be developing informational materials to share information about what is the Texas Sickle Cell Disease Registry, like frequently asked questions. And so CBO is helping us to distribute that information, getting the word out there, helping to answer these questions as well, because CBOs are really the link to the folks in the sickle cell community, right? And so you have your finger on the pulse of that sickle cell community in ways that the state health department will not. And so we really are relying on our community-based organization partners to help inform the sickle cell population and to help encourage folks to opt in to the registry.
Okay,
Yeah.
and how soon do you expect to have that information that we can give to people?
So, with regard to the information for how to opt in, that will not be available anytime soon, unfortunately. We still need to seek and engage communities for feedback regarding the opt-in process. And then once we have our assessment of the Texas Sickle Cell Disease Registry complete, as Prashant mentioned, we will have that final summary document that we will then present to the Texas legislature in the next session in 2027. And that's when we're going to request additional funding to implement the Texas Sickle Cell Disease Registry. And so once that sickle cell disease registry is implemented, it's taken to the vendor, the database is created. That's when we'll be in a position to really start informing individuals, hey, the registry is ready, and we are looking forward to folks learning more about it and to opting in.
Can I just interject here? Thank you so much, Daryl, for that question. Um, this process is a long one.
Mhm.
It's more like a marathon than a sprint. So, uh, as someone that really does believe that this registry is a good thing, it is the way that we will know where our warriors are and then in turn be able to know where to allocate resources. That is a quick little sentence that represents, a year, multi-year long process. So, Daryl, the As One Foundation, we have set aside this space for the next few months, probably leading up through October, to have these dedicated conversations here every third Thursday to understand we want to understand what this is, and I'll just note that we might need to spend a whole session on what the whole opt-in thing looks like. And also, what is the point of a registry and how does this registry actually affect our warriors and their families? What can they expect from it? And in turn, what truly is needed? Because 2028 is probably when we're going to actually be doing the opt-in, but now we're defining it. And in
Mhm.
defining it, can we go back? Because session, even explaining session is every other year in the state of Texas. So it's not even an annual process. So they've been off this year, if that's the correct way to say it, and they'll, re-up in January. We've got some plans working with the sponsor of the actual bill, but all of that I would love to see broken down and explained. So, Daryl, I invite you and all of the CBO leaders to meet us here every month to ask those questions, to make suggestions, to, maybe a thought will come into your head as you listen. But we are intentionally wanting to be engaged in this process as, something that we've contributed to. Stealing from Dr. Lakia Bailey of the Sickle Cell Community Consortium, nothing for us without us. And this is a way for our voices the voice of the patient, the voice of the caregiver, the voice of the family, the voices of the family members can be heard. Um, so uh, please chime in, come off mute, ask your question in the chat. Ms. Kofor, did you put your question in the chat because you
We
can't
did.
come off mute or what?
Can you hear me?
I can't.
I'm sorry. Yeah, I just put it in the chat, but I can come off mute. And I guess you answered a lot as far as narrowing it down that is a process and it's still in the works. So you don't really know specifics yet. And so it's just kind of helping us understand the steps. Because like you say, when we join these virtual policy forums, like we just did for 2026, it's kind of working on things the year prior to or leading up to the new ask or whatever. So you just kind of explain the process and the steps that we are currently in right now.
And Carla, you
Yes.
have a really wonderful question. Is the registry genotype specific? It will not be genotype specific, so all
Mhm.
genotypes within the sickle cell disease umbrella will be included in the registry.
All genotypes. Okay,
Mhm,
thank you so much. I didn't know if you knew the
Wonderful.
answer to that question yet or not, since we are still in the process.
mhm.
So thank you for answering
Of
that.
course. Mhm.
I have a question.
Yes.
This is Richie. Whereas I know this is the beginning phase for the sickle cell disease registry, do you think somewhere down the road that this will be amended to include sickle cell traits since it's just as important?
I do think it's very possible. I do know that a lot of the work that led to this registry was community driven. And so I imagine the community organizations understand the importance of sickle cell trait in addition to sickle cell disease, working with your representatives to help make that ask for the expansion to sickle cell trait. It's something I do see as likely.
Oh,
Thank
that's
you.
good. That's good to know.
We would love to see that.
For those that have just joined us, this is SCalate, which stands for Sickle Cell Across the Lived and Treatment Experience. We are listening to two experts from the Data Texas Data Collection State Health Department. Correct me if I'm wrong there, but this is all about the brand new Texas registry that has been signed into law. And you will need to repeat, and we're definitely, I think marketing 101 says a person needs to have 18 impressions of something before it actually sticks and lands. So we will need a repeat of some of the things that have been said, which is why we are happy that you guys are going to be joining us the next few weeks. But so yes, Texas has a registry. What can we do now is sort of where we are in the questions. But I would like it if, and I'm going to take a point of personal privilege, if each of our participants, if you feel comfortable coming off mute and just introducing yourself, if you represent a community, if you have genotype, if you have an organization, just briefly, 30, 45 seconds, tell us your name and your brief sickle cell story if you are so willing. And I'll just call you out. Ms. Kofor? Carla?
I'm sorry, I didn't know if you called me or not. Yes, my name is Carla Kofer. I reside here in Dallas, Texas. I am a caregiver of an adult warrior with genotype sickle beta thalassemia 0. Um, so uh, and so yes, and basically just in the throes of advocacy, getting more and more involved as she gets older and the years go by, and so that's my story. Thank you.
Claudette? Claudette, if you're okay, there you go.
Here, sorry about that. I was driving.
Oh,
Yeah, Claudette. Yeah, I'll be brief. Claudette, I am in Georgia, and I have a sickle cell trait, and I have a daughter who has sickle cell trait.
welcome. Thank you for being here. Daryl?
Yes, I'm Darrell Roseboro, sickle cell warrior, genotype SS, and I'm also the president and founder of Sickle Cell Warriors of Texas Corporation, and I reside in Longview, Texas.
Is that Yuji? Did I say that right?
Yes, you did. Hi, I'm Yuji. I'm a caregiver. I have two young adults, 20 and 18, both SS, and currently in Houston.
Thank you for being here. Patrina? Katrina, are you able to come off mute? If not, we can jump to Richie.
Hi.
Go ahead,
Hi.
Katrina.
Yeah, hi, I'm Katrina. I have sickle cell thalassemia. I do not live in the States. I'm in Canada. So I'm just
Okay.
joining you guys. Yeah.
Welcome. Richie?
Hello, everyone. I am Richie Johnson, President and CEO of the Christy J. Johnson Foundation. We're based in Sugar Land, Texas. I am a sickle cell trait warrior. I also had a son who had sickle cell trait and passed away after 15 months of diagnosis with the RAMC, which is renal medullary carcinoma, which is a rare kidney cancer that affects young individuals with sickle cell trait.
Thank you for being here. Thank you for your question. Stacy?
Good evening. I'm Stacy Darling. I am a sickle cell trait warrior myself and a board member of As One Foundation. My brother Devon Darling passed away in 2001 during football practice at Florida State University from sickle cell trait, and that was the beginning of As One Foundation. Now, lovely, we are based here in Houston, and our Dr. Dr. Tremia is in Atlanta. So we're both in both places, and also Florida as well. And I'm welcome to be here. Welcome everybody, and I'm very interested in wanting to know more and learning more. And I'm glad that we're making strides and continuing having strides in this situation here that we have. Yes, thank you.
Thank you. Thank you, Stacy. And finally, Teddy, if you are so moved.
Hi, yes. My name's Teddy. I'm also with Texas Department of State Health Services, just here as support for my colleagues here.
Awesome. Welcome, Teddy. So I just wanted you to have some idea of the depth and breadth of our participants, and I'm going to just pull a little bit more from them. If you have any questions, if there's anything you're wondering, this is the safe space to ask that question. We are delighted to have made contact with the organization, and I'm sure if I had written down my questions as you were presenting, I would have more, because I know that but people want to know if this, how this helps sickle cell. And I want you, the experts, to explain that and let others form their opinions about it, but also how does the warrior family be helped by it, but also contribute to it? So hopefully any of you, our Texas data collection program experts can answer that.
Yeah, of course.
Yeah.
So, oh, go ahead, Victoria.
Go for it, Prashant. Go for it.
Yeah, so that's a great question, right? How are we helping everybody. Well, let's start with a more general, higher overview of what the registry does, right? It captures data, it finds out where people live, where they're located, so we can help provide better care, better services to those locations. To, instead of somebody having to drive 45 minutes, we could have somebody 15 minutes from an area where most of them go. So that's a big reason of how we want to do it, right? That's one. And in terms of how it'll impact like the individual, I think we're still trying to figure that out. But again, every single individual that signs up tells us, hey, look, we know you have sickle cell disease. Let's figure out how we can help you get better care, right? Better care, whether that's going to an ER or that's going to a sickle cell disease clinic. That's how the sickle cell disease registry, I believe, will really help our sickle cell disease patients.
Yes, and
Anything?
to add on to that, the sickle cell registry will the main purpose is to inform practices and policies in the state of Texas related to sickle cell disease. And so not only as Prashant mentioned, but improving access to healthcare, but also the quality of healthcare as well, right? Not just in the emergency department, but also in your regular visits with your provider. Also, really informing educational resources. So resources not just for the sickle cell community, but also healthcare providers to help them better understand, what is sickle cell disease and how can you best support patients living with sickle cell disease. Um, and also, it can be an opportunity to help connect folks to maybe some research opportunities, maybe access to different programs, right? So we can share that information with folks within the registry, so that folks are staying aware of what's available out there in supporting living with sickle cell disease or caring for someone with sickle cell disease. And then I wanted to share an example in California through the Sickle Cell Data Collection Grant. They've been in the grant program since 2015, and they were able to leverage the data that they collected through the grant to help establish brand new sickle cell centers in the state of California. And so that's just an example of what we can do once we have this system of data collection, analysis, and reporting for the state of Texas specific to sickle cell disease. Claudette, I see you have a question.
Yes, I wasn't going to ask questions, but I'm hands-free, so I'm like, I just had two questions. The first one is there a model like this with any other disease, genetic disease that exists where they have a registry? And then my second question is, I'm not sure if you answered this in the beginning, I may have missed it. How is this different than the tests that they run on newborns? Because I thought that in the U.S., maybe it's different in different states that all newborns are tested for sickle cell trait and disease.
Yeah, those are really great questions. So there are other sickle cell disease registries in the U.S. There's only two that are opt-in, and that will be South Carolina, I believe, Prashant. Was that correct? Yeah,
Yes,
South
that's right.
Carolina, and then ours, which is still in development for the state of Texas. Um, and then how is this different from newborn screening? So newborn screening provides the test that helps identify sickle cell disease or trait at birth. And my understanding is that families with an infant who is identified as sickle cell disease or trait will receive information shortly after birth, right? And then some services with helping clinical care coordination. And so what the registry will do, it's a longitudinal data collection effort, right? So once the patient opts in, to be within the registry, then we're able to do that long-term follow-up and data collection throughout the lifespan. And that will help inform not just, sickle cell disease, how it looks like for various folks but also how it changes across the lifespan. And so there's not a lot of information right now for that. And so the registry can help provide that information, and that will help support new practices, new policies that will not just extend the life of individuals with sickle cell, but also improve the quality of life as well. So it's more of a long-term effort to really better understand sickle cell across the lifespan. Yes.
Go ahead.
Thank you. And for the first question, I was asking not about other sickle cell registries, or diseases. Other diseases, genetic diseases have registry, or is this like the first one?
Oh, right on. Yeah. So there are other like rare disease registries as well. And in Texas, what we also have is the Texas Birth Defects Registry. So that's something that's very similar. Infants identified at birth with a birth defect. Um, their information is collected across the lifespan, and that helps inform, practices and policies related to those specific birth defects. The only difference is that that is not an opt-in model, that is an opt-out model. Mhm. And then
I
other
have a
registry.
question.
Oh
Oh,
yeah, go
I'm
for it.
sorry. Go ahead.
Oh, I was just going to share that
Yeah.
other registries in Texas include, that there's a cancer registry,
Yeah.
there's a blood lead registry. So there are other registries in Texas. Mhm. My apologies, Richie. Go right ahead.
Oh, that's okay. I'm sorry. I thought you had completed it. But my question is, how will you roll out the education as a component of it? I know we're early in the early phase of it, but education is extremely important as far as educating parents. And I noticed that you said that having the registry, you'll be able to follow the patients all the way through. But education is extremely
Mhm.
powerful and is the key. So, what is the plan as far as educating parents when the child is young, and then also once the child becomes older, as far as educating them?
So that's a process that will is still in development, right? We will definitely be looking towards our community partners to help inform that process, because if the intent is for the sickle cell community to leverage this information, we want to develop something that makes sense for the community, right? And so once we have, a general idea, a plan of what that education will look like, then we'll definitely be reaching out to our community partners, seeking feedback on whether it makes sense. Um, Separate from the registry, but with the grant work that we're currently doing right now, we are partnering with UT Austin. We are working on a education campaign for healthcare providers on university campuses to help educate them on the transition from pediatric to adult sickle cell disease, and then also what is sickle cell disease, what are the complications, how can you best support students living with sickle cell disease. So we are doing some education campaigns right now with the scope of within the scope of the grant. But of course, with the registry, we definitely look forward to expanding on that using community feedback.
Thank you.
Mhm.
I'm going to interject once again here, just to give some context of how we got here. And that is, I may not have my numbers correctly, but hopefully you'll follow along. I guess 6 years ago, um, and I believe I'm recalling the organization, the Sickle Cell Association of Houston, whose board member at that time was Jarvis Johnson. One of the board members was Jarvis Johnson, who sponsored the bill. And you guys are going to have to, reel me in because I'm referring to the bill and the registry as all in one. And the first thing I learned is that they are not the same. And I appreciate your early slide that showed the difference and then the concentric circles of how they will work together. We'll definitely need to repeat that. But as I said, 6 years ago, 3 sessions ago, the Sickle Cell Association of Houston, with Jarvis Johnson leading the process, went to Congress and sponsored a bill for this registry and I believe other things. And while there was support, a growing support for it, it did not pass with the proper amount of support that it needed. So the following session, which was 2 years later, because it's every other year that there's a session, the bill did pass with bipartisan support. It made it to Governor Abbott's desk for signature, which would have signed it into law, and it was vetoed. This last round, and the members of the As One Foundation and other, I remember Dr. TT, plenty of folks went to Austin to testify in support of it. And finally, it again passed both with bipartisan support and was subsequently signed into law. That was a 6-year process, which got us to this moment, and that's on the registry side, or the bill rather. I'm just trying to put the process and the depth of time that we are looking at having already put in to what we could possibly look into going forward that has involved, advocacy in the halls of Congress and, taking meetings and writing letters and all of the above. But this is that advocacy in work. We will need much more going forward, especially, if you could still talk more about how, or if you can address how things like consent or opt-in be removed, or how trait could be added, and so whatever some of the other questions were. How can we in this process now affect that going forward?
So I think just reaching out to your representatives, right, expressing what you're hoping for with the registry, and because this is an opt-in registry, um, really helping us to educate the community, and to engage folks to opt in. Because if folks don't opt in, then the registry won't reach its full potential, right? And that full potential is really impacting those policies and practices in the state
Mhm.
of Texas for the sickle cell community. Um, as far as the consent process, no one's information can be included within the registry unless you have provided informed consent, right? And so we're still talking through how that might look like, but really it's reaching out to identified individuals, sharing that information, being very clear in that this is a registry database with integrity, firewall, those
Mhm.
protections in place, right, to protect individuals' information. Um, and so this is
And,
not, once you opt in, you're opt in forever. If at any point in time you feel, you know what, this might not be maybe this isn't what I thought it would be, right? You can always opt out at any time, right? And again, later on, if you want to opt right back in, that's no problem, right? We're very happy to provide that information, and to work with folks.
and to add on to that, if let's say they opted in, we have their data, and then they decide to opt out, we delete their data out of the registry. So that way they know that it's taken care of, right? We don't keep the data even though they've opted out. So we'll do
Mhm.
that. And then also we're going to try and make it seamless to basically register into the registry. And we're working through how we're going to do that, how to make it seamless and easy for them to sign up.
So do you see this look on my face? I don't want an opt-in. I really want people, because I feel as a researcher, we need to know how many folks in Texas are living with sickle cell disease and trait, especially in those rural pockets, and
Mhm.
because if we don't know about them, then resources don't get allocated toward them. And, forgive me if I'm oversimplifying the process, but so is becoming, it is eliminating the opt-in even possible? And before you answer that, I also just want to make sure that I mention that Representative Lauren Ashley Simmons did pick up the mantle uh, for this last session. She lives as a caregiver. Her daughter has sickle cell disease. So when Jarvis Johnson's term ended, she, with his blessing, picked up the mantle and sponsored this bill or re-sponsored this bill. And we are riding her coattails now as that advocate. So Lauren Ashley Simmons is definitely one legislator to be in contact and share your concerns. And I also understand that she had to, it was I guess recommended to include the opt-in in order for it to pass. So she did take that option, but understands that we really need everybody to automatically be put in it. Because the other point is, for another question that came up, yes, newborn screenings are happening and people that are newly born with sickle cell disease, but what about people that weren't tested? What about immigrant populations that entered the country? I'm aware of a person that didn't get diagnosed with sickle cell disease until they were in their 40s. So we still, there's a lot of people that we don't know about because they're not in any newborn screening database that we need to know about. They need resources. So can you also talk about how hospital data will inform this process? Or, and forgive me if you've already answered that.
That's a really great question. And so newborn screening, of course, is one avenue for identifying individuals with sickle cell disease. But of course, as you mentioned, not everyone was born in Texas. Folks moved to Texas, right? Or might be diagnosed at a later age. And so hospital and emergency discharge data, electronic case reports, those sorts of information that stem from healthcare facilities, that is an avenue for identifying those older individuals or folks who weren't born in Texas, right? And so that's the data source that we're hoping to leverage to help identify those individuals. And then as part
But if we
of
keep the opt-in, they have to consent for you to
they
use
have to
that data.
consent, yes. So anyone that we identify, we will reach out to them, provide information, and encourage them to opt in. Um, Folks that we are not able to identify through data sources, maybe they'll hear from their community, like, hey, did you hear about the Sickle Cell Disease Registry, right? And so we'll still have an opt-in method on our website. And so we are exploring different options for opting in, whether it's an online form, mail, fax, email, just to try to provide as many opportunities for folks. And then I also wanted to add that as part of the legislatively mandated registry, there is a mandated report to the legislature every year, right? And so once the registry is implemented, once the registry starts having data that we're able to share with the legislature, that could be something that is a component of the report, right? How many of identified individuals are opting in to the registry, right? And so that's just some things to keep in mind.
Thank you.
Hmm.
Any other questions, comments? I think this is a very good conversation that will continue.
Hmm.
We will be here every third Thursday. Thank you all for agreeing to be with us. We do have other subject matter, but this is pretty important. And hopefully, by a show of hands, will you guys join us next month and share questions in the meantime? You can certainly email info@asonefoundation.org. This will be on our YouTube, so you can leave questions in that chat as well. But I'll just ask one last time of our participants, do we have any last words, any other comments, questions, or concerns? Then I'll thank everyone for joining us tonight. And I'd love to leave the last words with our experts, Victoria and Prashant.
Thank you all again very much for allowing us into your space. We're always happy to talk about the Texas Sickle Cell Disease Registry. I'm very excited for its implementation. It holds potential, and I know that working with our community-based partners, we can help that registry reach its potential.
Thank you for having us, and please bring up any questions and anything else you want to learn more about. We can go into details that we've, gone through right now. So it would be great to hear some of that.
With that, I'll give everyone their evening back. Thank you so much. We'll see you next month.
Thank
Thank
you.
Thanks,
you.
y'all. Take care.
Thank
Bye.
you.
Bye-bye.
Bye-bye.